Now, Health Minister Zweli Mkhize is warning that the coronavirus infections are climbing once again. Over the past week, there's been a 9.1% increase in new cases. South Africa recorded over 2,000 infections at last count, raising concerns about a second wave. Let's get some insights now. We're joined by Wits Professor Shabir Madhi. Prof, thanks for your time. We appreciate it. So the Health Minister is raising some concerns, saying we're seeing an increase in infections over the past couple of days. Overnight, it was 2,055 new cases. How worried should we be about a second wave coming soon?
So good afternoon. So I think the short answer is that the resurgence is not surprising. South Africa is always going to experience a resurgence, and in fact, a few months ago, we had already been talking about possibly having 3 to 4 waves of outbreaks of COVID-19. The reason why we're probably experiencing some level of an increase in South Africa right now is because of greater complacency in terms of the recommendations of the use of non-pharmaceutical interventions. So as an example, what's been experienced in the Western Cape in 1 or 2 instances are what we call super spreader events, where people gather together in poorly ventilated areas, and consequently one person can infect many people over a very short period of time. In addition to which, what we're also observing empirically in South Africa is people are becoming more complacent with regard to the use of face masks in public spaces and other behavioral changes. So unfortunately, those sort of behaviors lends itself to an increase in terms of transmission of the virus. Even though there was a decline in terms of the first wave, we certainly weren't out of the woods. And the percentage of the people that have been infected in South Africa, especially in urban major metro areas, even if it be 30 to 40%, is still inadequate to control the transmission of the virus in the absence of people adhering to non-pharmaceutical intervention guidelines.
Yeah, so of course it's people's behavior that will get us to that second wave faster than normal. So if we compare what we're seeing in our numbers to Italy, for example, that's now seeing a second wave, it took them some time to see a second wave, right? But ours seems to be approaching quite fast.
Well, there's 2 components to it. So firstly, we need to be guarded in terms of making any sort of comparison to South Africa compared to Italy or Spain. And the reason for that is, an example, in Spain, after their first wave, less than 10% of the adult population had been infected. In the Western Cape, as an example, based on sero surveys that were done, it indicates that anyone between 35 to 45% of adults might have been infected with the first wave. In addition to which, there's differences in terms of the type of testing and the threshold that's used for testing between these countries. So we need to guard against making any sort of extrapolations from the Spanish or the Italian experience and what might occur in South Africa. These epidemics are playing out in a very, very different way in these different regions. So yes, Spain perhaps took a bit longer to have a resurgence, but much of the resurgence in Spain, in Italy, and much elsewhere in Europe is again because of the behavior of citizens during the summer vacation period. And I think that's where we're heading towards right now. As the weather warms up, people are more inclined to socialize, go out into gatherings, and unfortunately that lends itself to transmission of the virus, and that's when we're going to see the uptick that we're currently experiencing.
Yeah, so of course we heard from Professor Karim earlier in the week advising against inter-provincial travel and holidaying. I mean, is that something that people should consider going into the next couple of weeks? Would you agree with that?
No, certainly not. South Africa the virus is completely widespread in South Africa, and there's absolutely no reason for people not to be traveling within South Africa. It's going to make absolutely no difference to this epidemic and how it unfolds. If people travel, they need to do what is required, and that is to be responsible in terms of their behavior, irrespective of whether they're on vacation or not. People traveling within South Africa is not what is going to fuel the next resurgence. It's the behavior of people that is going to fuel the resurgence. So definitely not. That is not a risk factor in South Africa in terms of where we're heading with this particular epidemic. It's the behavior of citizens, irrespective of whether they're at home or whether they're traveling.
And if citizens don't change their behavior and we get a second wave and see about 5,000 to 6,000 new infections per day being recorded, do we go back to stricter measures of lockdown, would you recommend?
Yeah, so again, definitely not. And the reason for that, the lockdown itself, even the first level 5 lockdown, did not get rid of community transmission. What inadvertently happened in South Africa is that as the epidemic was actually surging, we actually went to lower levels of restriction. And consequently, what ended up happening is that a much higher percentage of the population ended up getting infected. Like I said, probably at least 1/3 of the adult population in major urban metro areas were infected in South Africa. So a lockdown did not control transmission of the virus. It perhaps delayed it for a little while, but the end result has been as many people likely have been infected that would have occurred in the absence of a lockdown. The only thing that really assisted us eventually was at least some level of adherence to these non-pharmaceutical interventions. A lockdown does not get rid of a virus, and in any country for that matter. A lockdown only works at an early stage of the epidemic to contain a virus if it's actually coupled with an effective testing strategy that identifies suspected cases and actually traces at least 75% of the contacts and put them into quarantine. That sort of a strategy has passed us by a long, long time ago, 5 months ago. So for South Africa to even consider going into another lockdown would basically be futile.
Interesting. Thank you so much for your time and your insight. Appreciate it, Professor.